A new daily record for COVID-19 vaccinations. That's even as the number of new cases here in Massachusetts slowly climbs, or maybe not so slowly. Here to answer your questions is Dr. Shira Doron, the hospital epidemiologist at Tufts Medical Center. Dr. Doron, good to see you.
Good to be here.
All right, so the state is now identifying 32 cities and towns as high risk for COVID infections. That is up from it's up by 12 communities from last week, and it's up from 12 communities over the last 2 weeks. So what concerns you most about our current trend?
Well, we've been seeing this steep decline in January and February, now leveling off with some areas increasing, and of course no one wants to see that. And the reasons for this new pattern are unclear, as were the reasons for the steep decline earlier in the year. Now, certainly I worry that people might be letting their guard down, and I worry about more contagious variants playing a role. But I'm reassured that so far, hospitalizations are not rising, and I feel like there's still a chance that if we vaccinate as fast as we can, and if we're careful, we'll see things going in the right direction again soon.
Well, FEMA just approved the Heinz Convention Center in Boston, you mentioned vaccinations, as one of 3 new federal vaccination sites. With the extra supply, it's about 6,000 doses a day. Do you think the state needs to consider making shots available to all adults now instead of waiting almost a month, a couple more weeks till April 19th?
Well, that depends. Right now, the allocation is based on vulnerability. And vaccination will have the greatest impact if the people most likely to contribute to spread or most likely to become severely ill are vaccinated sooner. And you don't want to have less vulnerable people competing with more vulnerable people for those vaccine appointment slots. But if at any point it turns out that mass vaccination sites are not vaccinating at maximum capacity and opening up eligibility can fix that problem, then that should happen immediately.
All right, as you know, Massachusetts now has a travel advisory in place instead of a travel order that required tests and quarantines to enter the state. So what do you want people to know before they decide to maybe leave for vacation and come back? A lot of folks trying to plan their summers right now.
It's hard. Everyone is so tired of staying put, but especially if you're unvaccinated, travel still carries a fair amount of risk. More so if you go somewhere with higher rates of COVID, more so if you have to interact with a lot of people, like in an airport, to get to or from your destination. So the travel advisory states that you should still obtain a COVID test or quarantine for 10 days upon return to Massachusetts to prevent the spread of infection.
I want to ask you about a new study suggesting that COVID-19 may infect the mouth and actually spread through saliva. Is that consistent with the transmission trends that you folks have seen?
Well, this is still early lab research, but very interesting. And you asked exactly the right question. What does this mean about transmission? For example, could the association that we've seen between singing and COVID transmission actually be due to the fact that people spit when they sing? I don't know, but I think we're going to learn a lot more about this in the next weeks to months.